The big story that's breaking at the moment, Mumbai has decided to go tough on the Dahi Handi celebrations during Gokulashtami tomorrow. No Dahi Handi pyramids will be allowed in Mumbai amidst a fresh third wave alert. Mumbaikars will have to comply with the COVID norms. The Chief Minister's appeal has though been rejected by the MNS and the BJP. MNS and BJP leaders have said that they will go ahead and try and organize Dahi Handi events, and some MNS leaders have now been detained. But Mumbai has decided to go tough on celebrations amidst warnings of a potential third wave being on the anvil. Now the fact is that Dahi Handi and today Krishna Janmashtami marks the start of the festive season. From now right up to Diwali in the first week of November, India will have a series of festivities. Today, of course, is Janmashtami. Mathura, the birthplace of Krishna, was packed, and sorry to say, COVID protocols were thrown out of the window. The long weekend has also seen large crowds gathering at Mumbai's Marine Drive and Juhu Beach. This even as the Maharashtra government ordered the ban of large gatherings. Let's not forget, India's spike can also be directly associated with what's been happening in Kerala, an upward trend that has been noticed in the last several weeks, particularly after the Onam celebrations in the state. The fact is that festive seasons in COVID times could be a recipe for a potential third wave. And that's going to be our focus on the news today. Take a look.
Mathura celebrates Lord Krishna's birthday with aartis, pujas and several events. Devotees crowded temples to offer prayers and lined up in hundreds for prasad. COVID norms were obvious casualty.
आपने तो मास्क लगाया ही नहीं है।
नहीं, जेब में रखा है मेरे।
तो जेब से क्या होगा?
वो देख रहा हूँ।
भाई साहब, आप सेल्फी तो ले रहे हैं, लेकिन मास्क तो लगाया नहीं आपने। दीजिए, जल्दी जल्दी। अरे 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 अरे, कहाँ भाग रहे हैं? मास्क तो लगाया।
ले मास्क, ले मास्क।
ये अभी तक तो लगाया नहीं रहा।
आप लगो तो कहावत है।
If Mathura was exuberant, Mumbai is guarded. Celebrations are subdued in India's financial capital, which normally sees thousands gather to build human pyramids to break the Dahi Handis. The city, which has borne the brunt of the COVID pandemic with maximum infections till date, is taking extra precautions.
भारतीय जनता पार्टी स्वयं एक शंखासुर बन चुकी है। जिस तरह के इनके आंदोलन हो रहे हैं, इसमें कोरोना के नियमों की पूरी तरह से धज्जियां उड़ाई जा रही है। चंद्रकांत पाटिल जी स्वयं मास्क नहीं पहनते, उनके साथ कोई भी मास्क नहीं पहन रहा, सोशल डिस्टेंसिंग का पालन नहीं हो रहा। निश्चित तौर पर यह कहा जा सकता है और जनता को हम ये कहना चाहते हैं कि भारतीय जनता पार्टी के नेता स्वयं एक कैरियर बन चुके हैं कोरोना के।
ये दुष्ट बुद्धि की सरकार है, सत्ता की मस्ती आई है, अहंकार आया है और इसके खिलाफ भारतीय जनता पार्टी ने आंदोलन करके ये सरकार को भगवान के पास प्रार्थना की है, भगवान इनको सद्बुद्धि दे।
Mumbai's biggest festival, Ganesh Chaturthi, is approaching, but the excitement is missing. Lal Bagh Cha Raja, which sees footfall of lakhs of people during the 11-day Ganesh festival, has closed doors for the second year.
This year, there is a situation is different. We know the pandemic is going on. COVID-19 is not completely controlled in our hand. And government of Maharashtra, government of India, in fact, Mumbai Mahanagar Palika is also working over this to control the COVID-19. And there is some situation is now better. But still, we are appealing our devotees to not to come here to take darshan lively, but take darshan online to their homes only. We are making all types of arrangement. We are accepting all types of technology to give online darshan to every devotees at their home only.
With the festive season beginning, India faces the threat of a third wave if adequate precautions are not taken. The country could learn from the bitter experience of Kerala, which is clocking 30,000 cases daily after opening up for Bakrid and Onam celebrations. While many experts say the worst might be over, The question is, can India afford to lower its guard? With Saurabh Bhaktania in Mumbai and Sanjay Sharma in Mathura, Bureau Report, India Today.
Let's raise the big questions then. Is the festive season now an invitation to a potential third wave in India? Should citizens willfully restrict the celebrations and political parties encourage the restrictions on celebrations during this festive season that is now beginning? What can India learn from the Kerala experience? Kerala, remember, opened up both for Bakri Eid and for Onam. Will vaccinations cushion the third wave? So is one being alarmist when suggesting a third wave could be sparked off? Joining me now, Dr. Hemant Thakkar, one of Mumbai's leading consultant physicians, Dr. Giridhar Babu, one of the country's leading epidemiologists, Dr. Anish T.S., Associate Professor of Community Medicine in Trivandrum, someone who tracks Kerala for us. Professor Gautam Menon is researcher in modeling of infectious diseases and professor at Ashoka University, and Dr. S.K. Sareen, one of the country's leading doctors and at the Institute of Liver and Biliary Sciences in the national capital. Thank you all very much for joining us. Let me come to you first, Dr. Thakkar, because you've been tracking this for us over several months and issuing several warnings. But look at what is happening in Mumbai. In Mumbai, the government has said that there should be complete ban, restriction on any human pyramids tomorrow during the Dahi Handi Gokulashtami celebrations. BJP MNS saying they are determined to go ahead. I've already been here only 48 hours in Mumbai. I'm seeing crowds of people at Juhu Beach, at Marine Drive. Is this now time for citizens to step back and say, look, we're not going to celebrate this year again, much like last year? Is 2021 different to 2020, Doctor?
I think at the outset, I must compliment our government, the local government, for inducing this law and guarding against a third surge. And it is time for citizens to realize that you have 60 years in your life and 60 times at least you will have Dahi Handi. If you missed it in 2020 or 2021, Ganapati resides in your heart. You don't have to go to a pandal, and Janmashtami, you don't have to climb the pyramid. Once bitten, twice shy, Mumbai has learnt its lessons well. We have been clocking lesser and lesser numbers, and I think the citizens have to keep away from all these public places. I'm afraid the Juhu beaches and the marine drives have to be curtailed. The police have to be strict. Remember, it's useless bolting the stable after the horse has run away. After Bakri Eid and Onam, with the majority youth surge, Kerala has imposed night curfew. I don't want Mumbai and Maharashtra to go the Kerala way. So whether it's Janmashtami, Pajushan, Ganapati or anything else, Mumbaikars and our Indian citizens know that there is life after 2021. There are festivals after 2021. Let us be patient. Vaccinations are progressing. Vaccinations will cushion the effect. But let us not lead on the third surge. This is my analysis and request.
You know, you're making an appeal in a sense to citizens to show restraint. I just want to get a sense though for a moment just to see whether epidemiologically there's a direct connection between the holding of festivals and the spike in cases. Dr. Giridhar Babu, we have seen it after Bakri Eid and Onam in Kerala that there has been a spike in cases, particularly in the last 10 days post Onam. Do you believe that there is this direct correlation between the holding of public festivals or public gatherings and the spike in cases across India? Do you believe that? Or do you believe that we've now reached, as some are saying, a level of immunity where actually being outdoor doesn't make a difference?
Rajdeep, I do believe that we have a lot of lessons from Kerala to pick up. But this is not in a negative way. Kerala's whatever is happening in the state and also what will happen in the rest of the country is a combination of what is the background seroprevalence and what is the vaccination coverage. The areas that will be worst hit in the next wave, whenever that is those areas which have low seroprevalence and poor vaccination coverage. Why Kerala is a good example is because the Kerala state had low seroprevalence, therefore it was prone for infection. When Delta kept surging, their vaccination coverage saved us. Their early detection and increased testing numbers have ensured that containment efforts are fine. This is not a luxury most of the other areas can have. So we need to prioritize areas with low seroprevalence and see how we can expand vaccination coverage at the same time prevent all super spreader events. Any festival, any congregation, any rally, any crowd as such will promote pooling of the susceptibles in one place. And when susceptibles are pooled in one place, the infection will spread faster. This we have seen in all over the world. So this is not new phenomena that epidemiologically we are going to see. But the real question is, will we be able to detect it early enough and then contain it? At the same time, can we identify the areas which requires the priority? Those are the questions now, Rajdeep.
You know, because the fact is, Professor Menon, there are conflicting views at the moment about this third wave. There are those who believe that all these events, starting with Janmashtami, building up into Ganesh Chaturthi in Maharashtra, building eventually up to Diwali, are all potential super spreader events. The other view is that we are now vaccinating fast enough, and therefore if you're in areas where vaccinations are high, you might have more than a fair chance of not having a sharp spike in this potential third wave. How do you see it? Are we heading for a third wave almost inevitably in festive season, given the fact that most Indians want to go out and celebrate? Do you see this as the critical 2 months, September and October?
I think it depends a lot on what part of the country you're talking about. For the north of India, for example, as Professor Babu said, you have very high levels of seroprevalence. You know, between Madhya Pradesh, Uttar Pradesh, Bihar, etc., that the numbers of people who've seen a prior infection is somewhere in excess of 70%, somewhere between 70 to 80% from about a month ago, more than a month ago. So in these areas, it's unlikely that you will see a rapid surge of anything that is substantial enough like the second wave. But it's the parts of the country which have seen lower seroprevalence, for example, Kerala and Maharashtra being two of these states, which have not ramped up vaccination to reach a sufficiently large fraction of their population yet, that we should be most worried about. It's these cases, it's these areas where festivals, opening up, etc., will make a difference in terms of transferring the infection to people who have not encountered it yet because they haven't been vaccinated. It's in these areas that we should be especially careful to avoid outdoor mixing, to avoid people in enclosed spaces, to improve ventilation as far as possible, so that we can get vaccinations to people before they get infected.
Is that, in a sense, Dr. Anish, the big lesson that you're there in Trivandrum that has been learned from the opening up, however restricted it was both during Onam and Bakrid, that because the seroprevalence in Kerala was low, then the opening up came at a time there was overcrowding, and Kerala has paid, in a sense, Dr. Anish, some kind of a price. Is that a lesson for the rest of the country to learn, in a way, that you have to be very careful in these large events, public festivals, before you decide to open up? Pressure from religious bodies cannot be allowed to become a reason to open up during the festive season.
Definitely, Kerala is a case study, but not completely in a negative sense. Kerala, during Onam holidays, it is actually opened up, especially the business were opened up. But there was no assembly of people just for celebration. Even the government was not doing that kind of celebration. But some business were opened up. That is to keep the economic live. And you know that Kerala is a place where the lockdown was much effective. And so many issues are there among the public. So that it is very difficult to again go for a lockdown or a containment. But definitely we have paid a price and around 10,000 additional number of cases per day. But that is expected already. But if you look at our hospitals are not filled. In southern districts, it is somewhere around 60% of the capacity is filled. And in northern, it is somewhere around 75%. And we are just vigilant on the numbers, and we are actually...
No, your capacity... Sir, sorry to interrupt. Your capacity... Your hospitals may not be filled to the brim, but the fact is the cases have risen. I mean, you could argue that that was inevitable, that at some stage, every state will face a wave. But the question arises whether we could manage these festivals a bit better. There are pressures on political parties, Dr. Sareen, that every time we are entering a festive season, allow us to open up. people must be allowed to celebrate. We are hearing the BJP and the MNS saying this in Mumbai today, that by not allowing Dahi Handi tomorrow, you are going against Hindu traditions. What does one tell people who now bring in Hindu traditions, or dare I say tomorrow Islamic traditions? You want to celebrate Eid, you want to celebrate Onam. What do you tell such people?
Well, Rajdeep, Corona does not differentiate between Hindu, Muslim, old, young. It infects. And every Indian must ask, do you want a third wave? And I think everyone will say no. We have to learn from some lessons from UK, where in Wembley, there was a large Euro 2020, just finished July. 67,000 people were there in the stadium, and there were 3,500 positive. Last week, there was a huge, music program, a show, cultural show. There were 50,000 people. The entry was you are negative 72 hours before, or you have both the doses, vaccination has been done. There were 4,000 plus people who got infected last week in UK. And we are thinking of having such big festivals in India, knowing fully well that we do not have 100% vaccination. UK is 71% close to. We don't have vaccination. Right. We don't wear masks so well. And I applaud the Maharashtra government for putting it up clearly. I wish they had done it much earlier. So let's be clear that the only way to prevent is not to have congregations. You can have birthday parties, but birthday parties increase the number of infected by about 8 times. So,
but I'll tell you, Doctor. Sure. No, all of you are making solid points, but I'll tell you what was the mood on the street yesterday, Dr. Thakkar. You are from Mumbai, I am from Mumbai. I went on Marine Drive and asked people why they were congregating in such large numbers. And they said, look, we are double vaccinated now. About 74% of Mumbai is single vaccinated. About over 20% of the adult population is double vaccinated. They said, look, we are okay now. We are double vaccinated. Why, we want to go out and enjoy, celebrate. We are entering festive season. We've been in our homes for much too long. What do I tell such people? Or what do you tell such people?
I'd like to very clearly point out that I have had in the last 1 month as many admissions of vaccinated people as of non-vaccinated people. In fact, today I sent home a senior doctor who had 2 vaccinations, who had to spend 15 days in ICU, vacillate between touch and go, and another 10 days in the ward. And we still have another doctor and his wife in the hospital. So just because you're vaccinated, haven't we talked of immune escape on your program? And unlocking for economy is different from unlocking for celebrations and festivals. You don't have to go to Marine Drive amidst 50,000 people or 5,000 procession. You can celebrate in smaller numbers, especially if you're vaccinated. Make a bubble of 10 vaccinated couples and meet in your society if you don't want to obey the norms where you have to completely isolate. Do it in smaller proportions. But vaccination can only cushion your disease. Vaccination is not an absolute insurance for hospitalization. Of course, vaccination can prevent you from losing your life as against the unvaccinated, but it will take the toll as it did with a couple of my colleagues whom I have recently discharged. So I don't think vaccination should be used. And one last point here is, people are throwing masks to the wind, caution to the wind. I want the government from the center to the state to impose a fine on anybody who takes a picture of these people and brings them to task. Because masking and unmasking are the 2 things which will help break the chain of transmission. This is extremely important.
Let me tell you, we met the Mumbai Municipal Commissioner, Dr. Thakkar, this afternoon, and he said he had instructed the police to ensure 500 rupee fines on the spot for anyone found without a mask as they were walking on Marine Drive. So clearly you need that kind of...
You're doing a great job.
So that's part of the problem. But Professor Girdhar Babu, how would you respond as an epidemiologist? If, as people were telling me yesterday on Marine Drive, look, we are double vaccinated, therefore we must be allowed now to be out there in public and celebrate. Do you believe, as Dr. Thakkar says, you can't make that distinction so easily?
Rajdeep, there are two issues. One is of equity, which means that it is the responsibility of the vaccinated to make sure that the unvaccinated don't get the infection from them. So therefore, people who are vaccinated, especially with 2 doses, should be even more careful that they don't transmit the infection to the unvaccinated. And the only way they can do it, not by giving vaccine, which is in short supply, but by wearing mask and following all the norms. The second aspect is, we have seen in every part of the world, breakthrough infections are common. At least 1/3 of the total infections in some places are breakthrough infections. So therefore, vaccinated people will continue to be one of the major determinants of future waves. We should be careful because they may not succumb directly, but they might result in others having fatalities. So therefore, vaccinated should show restraint and responsible behavior here.
Professor Menon, therefore the challenge perhaps in the next 2 months, and the government seems to recognize that, is to speed up vaccinations at one level. But are we also saying that while you speed up vaccinations, we are going to have to again live with another year of restricted festivities? Is that what we are saying? Because in 2 days' time, you've got schools reopening in the national capital, schools are opening in other parts of the country. There seem to be 2 kinds of pressures operating. Open up, allow normal activity. On the other hand, there are those who are saying none of this can happen unless you speed up vaccinations. Is there a middle ground?
I think there is a middle ground, and I certainly think that the calculus now has shifted in favor of opening schools. Children have been out of schools for far too long. In areas where already there's been a substantial burden of prior infection and where there is some reasonable level of vaccinations, at least our modeling shows that it is possible to open up schools. Cases may rise, but children usually have very, very mild forms of the disease. The worry is more about elderly people that they may go out and give it to, and that's where vaccination is important. There is simply no alternative to vaccinating faster and at a larger scale that we have been doing. Over the last few days, it's been encouraging to note that vaccination numbers are rising. They crossed 10 million at one point. If we can sustain that over the next few months, we will have all of our 950 million above 18s vaccinated, the adult population vaccinated, and then we can go and work harder on the second dose as well as potentially a third dose. But the only solution now to this is vaccination. Until we get there, we should be more careful. I don't think it'll be a whole year. I think it's a matter of 3 to 4 months. During that period, mask wearing is certainly one of the most important things that a citizen can do.
No, but just adding to that, Professor Menon, are you also in sync with what Dr. Thakkar and Professor Babu seem to believe, that even if you're vaccinated, because of the fear of breakthrough infection, that doesn't mean that you can be the one who says, look, I'm going to celebrate Ganesh Chaturthi. Why should I worry about these large crowds? I'm double vaccinated.
No, I agree with that. It's completely true that people who've been double vaccinated can potentially transfer the disease to other people. That's what we know about the virus currently. So it's incumbent upon them to be as careful as the people who've only been vaccinated partially and who've not been vaccinated at all. Because whatever you do, even though you may not fall seriously ill, you don't want to be responsible for someone else falling seriously ill. And at least let's sustain this. Certainly economic activity should come back, schools should open, but let's try to avoid very large crowding associated with, in a sense, voluntary events, religious events for the time being.
So, in a sense, what is it the one thing, Dr. Anish, there in Kerala, would you say that you've learned from the Kerala experience that would tell you, Dr. Anish, that this is the thing that we did, which didn't quite work, which, let's say, today Maharashtra, which now faces Ganesh Chaturthi, its biggest festival, North India is going to build up to Diwali, Bengal will build up to Durga Puja. What's the one big lesson that Kerala can afford these other states?
One thing is very important, to continue the virological surveillance, because this particular this assembly of people alone will not create large outbreaks. It may create increased cases, but if there is a genetic variation in virus is also there, it will go for a third wave. So whenever this particular assembly or this particular celebrations are happening, we have to concurrently build the genetic surveillance mechanism, so that we have to check whether there is a difference in viral virus nature or something. That is very important. That is one point I want to make. Along with that, this Kerala is very susceptible that because the seroprevalence rate is much less. But in terms of vaccination, now we are moving maybe number one state in country. And that may be giving some kind of room for that. Our cases are much less. But if you look at the number of deaths in Kerala, around 100 deaths are happening. And out of the 100 deaths, 80 or 85 is still happening in unvaccinated group. So if you want to reduce the clinical severity and mortality, definitely we have to go for vaccination. And vaccination is going to save lives.
So, most of you seem to suggest that. I want to ask all of you in conclusion, starting with you, Dr. Sareen. There are people out there who say, look, we've spent 18 months at home. And this is again talking to people yesterday at Marine Drive in Juhu. We've spent 18 months in Juhu. We want to, we want our freedom, is what one of them told me. And this is the time of the year, September, October, November, festive season. What will you tell them? Are we really heading, you feel, for a third wave, or is the third wave alarmist, Dr. Sareen?
Well, I would like people to understand how vulnerable each one of us is. First, vaccine is lock and key phenomena. The vaccine was developed for Wuhan virus, but now anywhere in the world, it is Delta variant. The Pfizer, the best vaccine, had 94% efficacy against the Wuhan virus, but 66% against the Delta variant. Our vaccines are only 70-80%, and we do not know whether the antibodies made are enough. So first thing, we are vulnerable and we are not fully vaccinated. Number two, despite vaccine or prior exposure, our antibody levels may dip down. Suppose you got a vaccine in February, March, both the dosages, maybe your antibodies are down. Third, we must ensure that we do not infect others. So if one variant comes from Kerala or Maharashtra to the other parts of the world or from overseas, we should not allow ourselves that the mutant virus spreads. Now, fourth, our schools are opening and we have a responsibility for our children more than our celebration. We need to look that the teachers are vaccinated, the parents from where the kids go are vaccinated. When they go home, they do not infect the parents or the teachers do not infect the kids. Therefore, our responsibility and our attention should be that we keep them safe. Our educational, academic programs go on. Right. Celebrations should be 2022. No way that we can celebrate. We have to understand we are responsible for others' safety. We are not allowed to make others infected. And that's the way we can prevent.
Okay, so very well put, Dr. Sareen. Very well put. Dr. Thakkar, third wave, exaggerated, alarmist, or do you believe it's real? We still need to live with the fear of a potential third wave.
I like Dr. Swaminathan's WHO doctor's statement. In times to come, in the next 4 to 6 months, COVID will become endemic in our country. Like H1N1, which was fatalistic and worrisome, has now been tempered down with increasing vaccination, with more and more subclinical infections. I can promise all my citizens that next year there will be a happier Onam, Janmashtami, etc., etc. We don't want to go the way US is going just now, because in South and Central USA, the cases have inundated the hospital, and in a country where there is plenty, they are suffering because of oxygen lack. Wear your mask, stay at home, take your vaccine. Think when on this channel we tell you in 2 weeks or 4 weeks' time that you need a booster jab, take it, obey the civil code, and 2022 will have a happier festival and a happier quality of life.
Happier festival, happier quality of life. If you can show the self-restraint today, this is the time not to lower your guard. The next 2 months, in a sense, are critical. Just a yes or no answer, if I may ask you, as the epidemiologist on the show, Professor Girdhar Babu, third wave can still be a reality?
Yeah, so especially in areas where there is low seroprevalence and poor coverage. So, Rajdeep, the summary here is let's celebrate life for now, and then we can celebrate festivals later.
What a wonderful line to end the show, end this part of the show on. Let's celebrate life we can always celebrate our festivals later. I hope someone out there is listening at the moment, both in our political class and you, the citizenry and civil society. Thank you all very much to all my fine medical minds for joining me here today on the news today. Thanks very much.